Hi, this is Dr. Laura Larson coming to you from Vail, Colorado, in Body Mind Assurance. Please hit subscribe because this is going to be a fluid, ongoing conversation, and we'd like you to keep up to date with us if you'd like to join us for that information. We're going to today talk about antibodies and antibody testing, and what does that mean for you, right? So first we're going to investigate the word immunity. The word immune, actually, definition of the dictionary, means having or producing antibodies, or lymphocytes capable of reacting with a specific antigen. An antigen is the virus, right, or the bug kind of thing. So when we're doing the nasal swab testing you've been hearing a lot about is actually going and creating a nasal swab, which is testing for the antigen to see if the virus is present on the test. That's an initial phase of testing, which we'll explain later. The antibodies are a response. So there's three types of antibodies that we're going to talk about right now. First wave comes in is called the innate immune response. That's the first response. It is instantaneous. The bug enters the body and the body responds. Boom, that's it, right away. There is no time delay on this immune response. It's the innate immune response, the first line of attack. Everything I like to call are like Pac-Men to me. So these are the first Pac-Men. And Pac-Man does what? He cleans up dots and monsters, toxins and bugs, right? So our first wave to clean up our bugs and our virus and the toxins that go along with that is the innate immune response. Some people have such a healthy innate immune response that they'll never go into the second wave of attack. But this is a pretty bad, nasty bug. So the next wave of attack, the next army to go in, is going to be the adaptive immune response. And there's two waves of that attack. The first one is called an IgM antibody. So if the first wave of the innate immune response doesn't kill that bug off, we're going to go in, the body's going to say, whoop, we got to send another army. We didn't get that guy, right? Here comes the adaptive immune response. These are the green guys, right? IgM. Those are going to show up around day 7, okay? And then we through a blood test, which is what everybody's talking about right now. The blood test is to test for the antibody being present. If it's present, that means we've had the antigen, it's come into contact, first innate immune response couldn't handle the problem, it's a bad bug, so we went into the second phase. Well, then what happens right after that? If, as the IgMs are fighting their battle, the first wave of attack comes from the body. It's called an IgG antibody, right? And those are our red guys. They're going to be the third wave in our adaptive immune response, IgG. So we're going to talk about how that affects you and how we're going to test that so you know where you are and if you've already been exposed to this virus. Okay, so let's talk about the testing available and what phase you may be in as far as this goes and how we can help determine if we've hit herd immunity and how we're doing as a community and as a world. So the first wave, day 1, here comes the bug. That's going to be right here at the beginning of our chart, right? Our first wave is what? It's an innate immune response. That's the blue one. Now this blue line over here is actually going to be testing the antigen, which is the genetic material of the virus. So it's actually saying, doing a nasal swab, is there virus on that swab? That's the blue line. So from day 0 to about day 28, that test would be positive, and then dropping here into the point it becomes negative. And that's when they're saying you've had it, if you got tested for that. And then when you're no longer testing positive, you should be here. Agreed? All right. Second test, which is the antibody test. Now, I am a natural holistic physician. I was first a chiropractor who went on to functional medicine. I do a lot of blood work in my office because we use blood work to take a snapshot of the body to see what the body needs in order to heal itself. We do nutritional support systems, a lot of complicated finding the right solution to the problem for the unique individual so they get well, okay? So because of that, I'm in what I call midline of care. The end line of care is the hospitals, the respirators, the drugs, right? The medical model. Where we're trying to find out is my group of patients are midline care. 90% of the population is never going to go in the hospital for this bug. And a lot of you will probably never be tested until you get the antibody test, right? So because of that, this is my audience. We want to find out where are you, when did you have the bug, and what phase are you in? If you are in a severe state and you think you're in an acute phase of care and requiring medical intervention, you need to report to the hospital because that is a different phase of care. And I think if you listen to your body, you're going to know who you are, okay? So, second phase of care. Then we're going to say if this is the antigen, the nasal swab test, which is only available and really testing what you have it during that 28-day cycle of the bug, right? The next test is the blood test. This is what we're going to be offering the majority of the time in our office. Okay, the bug enters the body. 0 to 5 days, they're calling the asymptomatic phase, which means you don't even know you have it yet, right? Symptoms are showing up day 5. They've done studies, it's about day 5, between day 5 and day 7. So when the symptoms show up, There's the onset of symptoms. Then what comes into that second wave? Here come the IgMs. That's our army coming in to help out, right? Testing for antibodies before day 7, which is really day 2 of symptoms, is really probably not going to find a whole lot because look right here, it's not even positive, right? Then we're going to go ahead and take a blood test somewhere as the case goes. We're going to do blood work. That's the antibody test. What this means is we're going to test for IgMs, the green line, and IgGs, the red line, right? We're going to get blood work back. We're going to find out which are positive. IgMs will be positive between about day 7, which is really day 2 of symptoms, through about, they're saying day 22, which is again, day 17 of symptoms. It's still a shorter phase. Now, in other viruses, sometimes IgMs can be positive for up to 2 to 4 months. This is the testing that's showing it right now. Again, this is a fluid situation. Stay tuned. It could be changing, but right now, this is the model they're going with, okay? And then IgGs roll in around day 14, which is about day 9 of symptoms, right? Okay, from day 14 on over, the IgGs roll up. They come over, they peak out, they've got into their army, and they stay in the body. So for the example, I'll use the example of measles. If someone actually had the measles, we know that their IgGs go up and they actually stay. It's a lifelong immunity. They're immune forever. Now, this virus, we just don't know yet. It's going to take some data, and we're going to be able to catch it. How? Because we're going to do blood work on people, right? We're going to be able to find out, are those IgGs still available 1 year, 5 years, 10 years, or a lifetime for this bug, right? Stay tuned. So what does this mean? This means we're going to get our blood tested, right? We're going to look for antibodies. You're either going to be negative, which means I've never had contact, or it means I've never had a response in my IgGs or my IgMs, right? We're going to get blood tested. We're going to find out, did we get in contact with this bug? Number 2, we're going to say, what kind of antibodies do I have? If we are positive for IgMs, that means we're still in the initial phase and you've had the bug in the last, 3 weeks, right? So that means these are still available and positive. Now, if we get the blood test and we have IgM and IgG, right? That means we are now in this phase where the green and the red are both positive. I don't know, day 14 to 19, somewhere in there, right? Okay, now if we get the blood test and we are only positive for IgG, but IgM is negative, that means we had that bug at least a month ago. Again, we don't really know the time frame of when IgMs are going to go away yet exactly, but this is the model. Let's say it's 21 days, which means you are past 21 days, but you've already had the bug. Does that make sense? Okay, so why do we get blood tested? What's the purpose of finding out with antibodies? And honestly, a lot of you asking the same question I am. Did I already have contact with this bug? Right? It's been winter. I'm up in Vail, Colorado. It's cold up here. It just snowed a couple days ago again. It's April. And basically up here, a lot of people are saying, hey, I got sick this winter. And maybe it was a little worse than normal. I don't know. Again, they're saying a lot of people may be asymptomatic and not even know if they got the bug or not, right? The only way we're going to know is blood work, right? And that's why, like in functional medicine, I love blood work because it's a snapshot of what was going on inside the body without knowing necessarily just with the symptom on the outside of the body, right? IgGs and IgMs are not about symptoms. They're saying, did you have contact with the virus, symptom or not, right? And what we want to find out is who did. If you've already had it, if you've already been in contact, if you are now in the IgG phase and it's behind you, therefore you are, by definition, according to Webster, immune, right? And if you're immune, we don't know how long for. That will be ongoing and upcoming. But you're immune, which means it's time to move on and maybe we can get out and get the social distancing moving, especially with the people we know that are safe. So who wants to be tested?